can pick an infection from one patient and pick it and give it to the patient. When every patient that walk into the department, how do you deal with them? These days, potentially everybody is a carrier of COVID-19 until proven otherwise, because we now have deep and vast community, transmission going on. So a lot of people are carrying it about, and if you do not put measures in place to actually protect yourself, recently, I think it was yesterday, I was hearing a message about a group of doctors who got infected in an hospital. In one particular hospital, we had so many doctors, I think about 20 of them became positive. And then you then start asking, how could that happen so quickly? It's because of the way that we are relating with this virus ourselves. So we'll protect ourselves, we'll protect our colleagues, and there are a few things that I want to talk about. Hand washing the way we wash our hand. We need to learn to wash our hand properly. We need to, all the measures that we put in place, that the government has been shouting. If you cough in an elbow, if you are unwell, if you feel like you have things that look like malaria, malaise, fever. I use the word malaria because in England, where I practice, when you feel like you have flu, that's when you then know that, of course, you caught a bug. And if I have a flu, I don't go to work. So if you're here, the only way you feel if you have a flu, because the virus we're talking about is a flu virus, really. So if you feel like you have a malaria, you have sore throat, you have a fever, you just know, of course, as a doctor, that you're not well. That's not the time that you then start going to work. Because if you start doing that, you're not helping yourself. You're not helping the system that you work for. And then trust is an issue. We need to be able to trust ourselves, because when we say that you can take time off, don't come to work if you don't feel well, some people take advantage. They then start, being unwell all the time now because they want to go off work. It's not, as a doctor, there's that level of trust that we need to have. You know that when you are off work, you are supposed to be at work and you are not unwell and you stay at home. If you do not break it down, let me break it down for you. Your colleagues at work will be stressed out. There will be loads going on there, and then you will be potentially exposing them even to risk. So we need to have that measure of trust in themselves, so that we know that if you said you are not coming to work, then we know that something is not right with you. But if you come to work, you know that potentially you can actually transfer to others. So we need to try and find a way of balancing that. I don't know how many of us have our jabs every year. Jabs in the sense that you have your vaccination, hepatitis B, hepatitis C, and make sure that everybody has their BCG, scar and things like that. I don't know whether our HR, whether they do. These are one of the things. It's not inexecutive, because it's very important. If you have people, I recently did a training for a group of health workers, I think 2 weeks ago, and I try to emphasize the fact that if you do not vaccinate yourself against all the necessary infections that are rampant in the hospital, anybody that has this infection that comes to the hospital is like you're going to war without carrying a gun. And that means you're exposing yourself to actually serious risk. So we need to check our vaccination status to improve our own immunity. Hand gloves, they're very important. Not only hand gloves, your PPEs, they're not expensive. If your hospitals are not buying this for you, please try and get these things yourself. I know that it should be the responsibility of your employer, your hospital, to get these things available, but it might not be the system. It might not be what's going on, but you need to think and think about your family as well. So hand gloves, your face mask. I will talk a bit about, if time permits, I'll talk about some of these things in more details later. If people that are unwell amongst us, you need to learn to have a doctor. You're a doctor yourself, but don't treat yourself. Get to be seen by a colleague, or at least, even if it's going to be telephone consultation or things, discuss with colleagues. Don't treat yourself as a doctor. So if you need antibiotics, somebody can prescribe for you. I know that we can walk into the chemist, but sometimes our mind is not really tuned right when we're treating ourselves. Maybe something that you're supposed to use is something as small as amoxicillin. You might be thinking about the third generation, cephalosporin. But if you say to your colleague can then dampen things and make things right for you because of the risk that we know is involved when you use unnecessary antibiotics here and there. So, sorry, this thing is obstructing my view. Let's move this away. Okay. Yeah. So, yeah, and then our cleaning measures. You need to get your cleaners trained. I did a training for a group of cleaners in healthcare facilities recently as well. We need to let our cleaners know the right way. They need to actually know what IPC is all about, infection prevention and control, because they are the center of it. If they do not know what they're doing, everybody is at risk. I talked about a virus. One virus comes and clean that particular virus at a point in time, we'll have cop this. Even this COVID-19 we're talking about, if somebody had done what they're supposed to do right, unless the hypothesis that this was an intentional, a laboratory virus that was brought into the system, if somebody had done their work right, we shouldn't have this thing, wherever it is, to come into the public. We have cleaned well, and you can imagine from Wuhan and the whole world in a very short span because of the level of infectivity of this virus. So it's important for us to train our cleaners, as basic as they are. Don't forget, they're very, very important, really important to what we're doing. Because if you do not clean your patient's linen, they do not clean your patient's beds well, they do not clean the floor well, they do not clean at the right time, you, even as a doctor, you are also at risk. So cleaning is very, very important. We need to educate our patient as well. Information should be generous. You should let people understand, what they should be worried about, what they need to do. I know with this COVID being around now, there's been a lot of, education going on in radio, on TV, and people. So we need to carry that on. And then we need to, in our own locality, we need to find a way of making that robust to our patient, because it's not only one person's job. This virus, we cannot fight with this virus on our own. Everybody have to be on guard, and that's very important because you are the center of it all. Okay, so let's go. Right, so the public health team, they've been doing a lot of work, and we need to also support them. Surveillance information that we're gathering from our own hospitals, we need to find a way of communicating this across, not only because of the fact that we need to just gather the information, it's because the information is what gives us whatever fact that you put together and you send to them is what we then use to inform what they're going to do next, and that will inform the policy that you're going to put in place. I'm not expecting one hospital to do the same thing as the other hospital. The reason is simple, because things are peculiar to a particular hospital. The way you do things, say in Sobi in Ilorin, the way they do something in Okoye, be different from the way them Tunde will be doing it in Omara. So you need to understand the fact that you are an entity on your own, and then you need to, sorry, this thing keeps popping up. Okay, so you need to use whatever information that you have in your own locality to inform, whatever you're doing. I think the last time I came to Kwara, I don't know whether it was NMA or some other group I spoke with, I was talking about, audits. Do we actually audit things? As things change, the way we're doing our own thing, do we really do audits? Audits is very important. When you audit things that you do, you improve. You just continually improve. It's very important for us to put this element in place. And then we'll talk about prevention. We're still going to talk more about the prevention and the control as well. So we all know that infection is a process by which the body gets invaded by a pathogen, which then can multiply. It's found an environment where it can multiply and and then group itself. If you look at COVID-19, for instance, we know that COVID-19 is an enveloped virus, an RNA enveloped virus. And surrounding the envelope are some glycopeptides, and then you can find like a crown-like spike on the virus itself, and it's this spike that then gives it its name, corona. Now, why this is important is with this spike is what this virus uses to dock on human cells. If it finds its way into the mucosa where it can actually penetrate and get to the right place, like in the alveoli of the lungs. And from there, it docks itself and it takes over the control of the cells, use the cells to replicate more of its kind. And in that case, it is, this works. And that's why we found that the respiratory symptoms and things like this is very prominent in this virus propagation or infection. So generally, we know that infection is the ability of a pathogen to be able to invade the tissue, which in the case of corona is able to do because it can dock with the receptor ACE. And then once it docks with this, and then it can then invade the tissue and propagate, multiply itself, and then cause damage to the tissue. So it is basic. It's not only corona. Most pathogens, that's what happens. And once they're able to do this, then that process leads to a disease. Now, infection prevention is very important. This is not only being upgraded. Okay, that's fine. So this is not only just a mere we're cleaning. That means that we're then preventing infection. It's a scientific process. This process is one thing that we need to learn as a healthcare team. And the process will involve, developing policy, procedures, and practical solutions that you put in place to prevent, or reduce the spread or the risk of infection to man or to animal. So it's not just we're cleaning alone. You have to learn to put policies in place. You need to learn to put procedures in place. If somebody comes to your hospital now, at the point that they get in contact with your facility, what are the things that you put in place? Are they able to wash their hands? Are they going to use gloves? Are you going to say, okay, you can't enter this place without you putting your face mask on properly? Because I've seen all sorts here, the way people, oh my God. You see, in Nigeria, we don't actually, I don't know what it is with us Nigerians. We hate practical solutions. This is why this virus is getting so wide and is moving very fast and it's killing quite a lot of people now. I'll put an example. When I brought some of these trainers to train for this test here it was last week and upper week. It was shocking. We found people were coming from the hospital. You see them, all they put something that just cover their mouth like this. And they said they wear gloves. They're wearing their face masks. You need to see me shouting. And then they can't understand the importance of social distancing. You understand? Just stay back. They will come to you, almost entering into your nose or your mouth with their nose just blowing everything like that. What? That means these people are coming from hospitals where they do not even understand the importance of this. Then also as a doctor, I've seen colleagues. If you see colleagues wear face masks, I can see Dr. Adewumi, they're wearing face mask the correct way. I just look at people, why are we like this? Do we not understand that there's a reason why we're actually using this thing? It's not only to cover your mouth, it's to cover the whole of your mouth and your nose. People talk about carbon monoxide, carbon dioxide poisoning. It's fallacy. It's not possible. It's not true. Even if you use 10 of those things, it's not going to give you you're not going to retain any CO2 or CO. You understand? So it's important for us to do things. And when we say a policy and procedure and practical solution, let's enforce it as much as possible. In the small place that we work, you need to be leader there, for you, because it's not a joke. COVID-19, we all know, all of us on this platform, I believe we know that COVID-19 is not a joke. It's here. See what happened in Italy. See what happened in the UK. See what happened in the US. See what happened elsewhere. And it's not stopping. We're just being hit now. And we're going, our level is going up. We even haven't reached the peak. More going to be us in the hospital. So we're at risk. That's why we lose a lot of our, our colleagues. And then we need to know that for every life lost, there's so much that is involved. Their family is going to suffer. That person's career is, of course, finished. No more. So we need to put things in place and enforce it as important as it is. You understand? People say, why is it that this thing is affecting all these executives in position of power? It's because they do not understand policy. They just call themselves that. There's no policy that these people, they defile all policy and procedure to do stuff. People believe if you fly in from abroad now, you get to the airport, as soon as you enter everything is chaotic. People that were in the UK just now, obeying rules and laws, then you see one soldier coming from here, one police coming from there, carrying back, they dismantle to destroy the queues. It shouldn't be like that. We should be able to learn to be sane in what we do. You understand? I know the system itself is crazy. The system is quite frustrating. When I came to Kwara to do the 10 days project that I did the last time, I came back home with headache. I was shouting all over the place. It's important for us to learn to obey the rules and understand it, because you obey it when you understand it. It's when we do not understand, and that's why such training like this is very important. Every other person to follow, but for people to follow you, you need the way. You need to do the right thing. If you're putting you, they're watching you. So when you're doing that, you can't tell people now that they should do it when you are not doing it, because they see you in that way. So it's important for us in prevention for us to put policy, procedures, and things in place. Well, infectious diseases. This kills more people worldwide, like we know. And obviously, I'm not going to go dwell in this one. This was made for me. We know that we can spread this in various ways. Even we're talking about COVID-19. COVID-19, initially we thought it was airdrop alone. We believe that you can only spread it by way of coughing. And when it comes to the cough, with the droplet of infection, which is heavy, you can propel it up a certain distance. Initially, we said 1 meter, that's 2 meters. There have been a lot of research that say if you cough well 2 meters, and you can even exceed 2 meters to spread it, to push this thing out. So by coughing, you can actually, you can expel, you can discharge the virus. The virus will land on the surface. The surface can be, it can be on the table, it can be on the wall. All the time, every places that people touch a lot, you can find this virus around that area, and it can last hours, if not days. And in various different surfaces, we have different time by which it can stay, and it sometimes stays for 2 days on some surfaces. You can still go there and pick it. At this stage, I'm not going to be too. Let me talk about the science of soap here, so that we all understand why it's important for us to wash our hands well. I've seen people wash their hands on sort of forms. Now, you know that if you're using sanitizer, you need to look at the sanitizer you're using. Let me start from there. The sanitizer you're going to use has to be one with at least 70% concentration. Some people say 65%, but I would say let's say 70% concentration. Look at that, make sure. Because when you're using sanitizer, what you're trying to do is to kill the bacteria. You're not washing it off. So you actually want to kill the bacteria in your hand, and you rub it generously. I think I have 1 minute. I have one here. It's just important for us to demonstrate it. So this is one of it. I always, when I'm using this thing, I make sure that I would generously put this thing on my hands. Oh, okay, I can't even open it. Anyway, you generously put it on your hand and rub it well around everywhere in your hand, so that it will cover the bacteria. Like we say, it's an envelope bacteria. It's going to die you know, if as long as you open up the envelope, you expose the nucleic acid, and then it's going to die. So what you're trying to do here is to kill that. We all know that. Now, when it comes to washing your hand, peptide on the surface of the membrane of COVID-19. So this glycopeptide is the main thing, because it gives it a kind of slippery, you know, it becomes slippery, more like oil. Like if you've eaten egusi soup, you want to wash your hand off the egusi oil. You don't just run it under the tap and then you rub it for 10 hours under the tap and you think you wash the oil. No, because what this virus is like is like you have like egusi soup oil in your hand. That's the way I see it when I want to wash. What you're doing when you're washing the oil of your hand is to use a detergent to actually lift the oil off your finger or your hand or whatever. So you have to use a soap, and then you need to rub this soap up on all your hands, like in the direction that you're supposed to do. You need to do all the necessary, thing, and then make sure that all everywhere in your hand is being completely, you've reached it completely. That means you've used the soap to lift the virus off your hand. And that's not the end. After you've lifted it off your hand, you need to run water, on it to then release your hand off it, because you've lifted it off your hand. The detergent might kill, might not kill, depending on the concentration. A lot of the time it doesn't kill, it just will lift it off so that the oil is lifted off your hand at this stage. Then you need to run water to wash it. So when you're using water to wash your hand, you need at least 20 seconds. That's where we talk about 20 seconds. Need to wash your hand for 20 seconds before you can say that your hand is clean. So, but make sure that you go through every aspect of your hand that needs cleaning, and then you run water through it. So those are the two things. So I call this the science of soap. So it's very important for us to understand that. And when we're teaching our cleaners, our nurses, let them understand this, so that people know that it's not like you run water in your hand. I'm for me, I've washed it. No, you haven't. You're still carrying the virus around. Wash it properly for you to wash it away. Okay, so let's go. Now, of course, there are various things we're fighting. We fight these 4 things, as simple as a bacteria, virus, protozoa, fungi, when it comes to infectious diseases. So that's basic. I'm not going to go. I'm just going to flip through this because they're not particularly relevant to us, because I want to believe that we all know what primary infection is. It's an infection that is directly affecting the host, hence it's primary. Of course, the secondary infection is when there's an immunocompromised person. They have a second infection. They have a secondary infection. Things that would not cause problem normally then start causing problem. Local infection is targeted to a particular organ, and there are cardinal signs of infection there. So systemic infection is when infection is actually gone into the body, is spread, and then we have septicemia. Again, in the hospital, they have septicemia protocol. There are protocols for all these things. We even have SOPs in our hospitals. It's very important because all these things link into what we need to be, it just makes life easy and packs easy for us if we have all these things. So that what I tend to do, sorry, I didn't tell you, I happen to be a medical director for 2 subsidiaries of NHS England and also a responsible officer. So I work for GMC in terms of recommending doctors for their relicensing and for revalidations in the UK. In the UK, I'm going all over the place. Sorry, I just need the things I'm supposed to have done, but because of the way this presentation came, I just wanted to do it. So I will juggle things. Please just bear with me. So, so in the UK, we have a process by which things work. So if you are to practice in England, for instance, you need to annually do your appraiser. You understand? Like we do here, like you do your annual CME. I don't know, you put CME and things together, but it's not structured here. What we do here, to me, is just FIP. We're just deceiving ourselves. I'm sorry to say, I've said this to them in the Council of Nigeria as well. I don't think we're doing the right things, but it comes to what I said earlier on, policy and procedure. We don't like it. So in the UK, as a doctor, for you to continue to practice, every 5 years, you have to be revalidated. So you are continuously learning every day. So this year, for instance, you will have to have your appraiser. Appraiser means there are certain things that you need to put in, you need to do. So you have a PDP, a personal development plan for last year. You must achieve it this year. So you will say at the beginning of your appraiser year, personally, these are the things I want to learn. I want to learn how to teach. I want to learn how to treat people with my cardiac infarction effectively. I want to make sure that I've done one update. So these are the things I want to achieve this year. So you must achieve it at the end of the year. So you have a plan. Every year you're planning and you're learning and you're growing. So after you've done that, you have what they call the CME, your CME points. You need to have at least 50 CME points every year. And then apart from that, your colleagues will have to feedback, about you. So you will have, and anonymously, your colleague will have to, they need to feedback about your practice, about what you do, their own view. It's anonymous. You will never see it. The feedback, it goes into a portfolio. It comes to the appraiser. I do appraise. So it comes to me. I have a look. I summarize everything. I call you, discuss it. This is the area they think you need to improve. You understand? And then you use that one to formulate a plan for the next year. So you do all these things. You put everything together at the end of the year. So every year you have that. And then at the end of your 5th year, then you have a revalidation. So I do revalidation. I do appraiser for our doctors. So I sort of see all sort of a lot of these things during the course of this responsibility. Now, acute infection, systemic infection, I'm not going to dwell too much on this. I expect us to know what all this are. A systemic infection is an infection that, it's slow growing and it lasts longer. An acute infection is sudden and it's short-lived. Iatrogenic infection that is as a result of us. We're treating the patient, but then we cause them of an infection. And this is the core of what we're talking about, infection prevention and control. We do not want this to happen. So that we need to do, if we do our due diligence well, then this will not be an issue in our hospitals. Now, of importance, nosocomial infection, obviously. So hospital-acquired infection falls in this. So in our hospital, when a patient comes in, don't let them go away with what they did not come with, please. And that's where what we're going to talk about next. Very important. The chain is able to go through the chain and then go through it successfully. Okay, so it means that you have a pathogen. The pathogen must have a way by which they will grow, and that means there must be a reservoir. So a pathogen does not can't get into the reservoir unless there's a transmission between where that pathogen is to the reservoir. So if we look at COVID-19, for instance, in Wuhan, we're not sure whether this thing came from the bat or whether it came from the snakes or it came from or penguins or whatever, pangolins or something. So we don't know where it came from. We know there was a reservoir. Some people say maybe it's from the laboratories, but there was a reservoir. So that it has to be somewhere. But if that thing does not move from that reservoir, find a way of getting to another host, then there will be no propagation of this infection. So COVID-19 has been existing, not yesterday, not last year. It would have been existing for only God knows when, you understand? But it got into human environment because something has happened along the line. So this chain then became a complete chain. So it can then propagate, get and be carried from somewhere to another place amongst within human. So you have a reservoir, and then from the reservoir there must be a portal of exit. There must be a way by which this has to come out. So if you have somebody in isolation center who is a reservoir of COVID-19, there must be a way by which this person is able to move this thing to another person. That's why when you see people all about walking around in the cars or in buses, crowded together, not wearing masks, what are we doing? what are we doing? We are just completing the chain of infection for this particular virus. So we need to find a way of breaking this chain. So it means that once you have these infected people, they're mingling among with people who are not infected, you are propagating, you are creating a kind of transmission channel for this virus to move very quickly from one person to the other, and it goes about like that. The same thing happened in the hospital. When you see a patient who you suspect is COVID-19 a patient, you do not do all the necessary procedures, then you will be able to carry that particular virus. Then you become a vector, like your hand can become a vector. Your hand then becomes a vector to carry this particular COVID-19, and it can take it from one place to the other. You understand? So, but once you understand that, oh, this thing my hand can carry it, as simple as let me wash my hand, then you break the chain, which is what we're going to talk about next. So there's a chain infection. Chain of infection, you have the pathogen, exit, means of transmission, port of exit from the port of entry into a new host. It gets into a new host. The new host becomes a reservoir when they become unwell as well. So that chain, for any infection to go on, that chain has to be continually, continuous. So now that's exactly what I've just talked about. So that's a chain. It's a locked chain. This is what's happening in our community now. We have these changes completely. We just triggered the chain and we left it there. So what we need to be doing to take care of this COVID-19 in our country, to find a way of actually, let's move this forward a bit. Pick this. So we need to find a way of breaking this, break it here, break it here. We need to find a way of breaking it here, breaking it here, So we need to put policies, procedures in place to this. That's the only way we can. So what are the risks? Who are at risk? We are all at risk, all of us. The staff in the hospital, you're at risk. The doctors, more at risk because you're close to this patient. If you do not protect yourself, it doesn't cost much for you to, this thing, I don't know if you can see, if you're seeing any patient, this, as simple as this thing is, it will save you. But one thing I realize is some people will use this, they put it on, and they will not put their gloves, their mask, no mask. Then you put this thing and then you're bouncing around and see people on the road. I just shake my head. So what's the point? There's no point using the face mask without, if you're using the shield without using the mask. For every patient that you see, I would suggest this thing is not expensive. If you're having a problem to get it, contact me, I will get for you. They're very, very cheap, they're easy to get. Keep one and make sure you clean it when you get, make sure you find a way of sanitizing yours. Don't carry it and then, even though you're protecting yourself, you're then using it to discharge or risk. Make sure that you clean it. You understand? So they're not expensive. And then this thing as well. Even surgical mask. Surgical mask is more than enough. If you cannot buy the N95 or whatever, I would say, okay, the N95 is a little bit expensive, but at least your face, your surgical mask, for all the patients, you say one surgical mask and this one, there's no way I go, if you get in my car, you will find a pack or 2 packs of surgical masks. I'm not going to even fuck around with it. If I find somebody that I want to work with and they're doing whatever, I'll make sure I give them and force them to use it. You understand? I just have to, that's the only way I can protect myself. You can't come to my house without, of course I'm alone here now, but if you come into my house and you have to wear your mask, I have everything just laid down here. You wash your hand, So that's just little things. We have to put it in our mentality to protect ourselves and protect others. It's very important. So patients at risk, you are at risk, and then the community is even at risk. If anything happens in the hospital, if you do not do your procedure well, maybe your cleaners, if they do not understand the color coding, they go and put something they're supposed to put in red bin. They put it in a black bin, and the black bin, they carry this thing, go and dump it in a general waste, and then the thing gets in there, from it getting into general waste, you can get into the community. Patient can come into your hospital. If you do not show them, the right procedure, whatever is in the hospital, they will take it and take it to their home. So in 2 weeks' time, you have more of this patient coming in to come and infect you this time around. So it's very important for us to like I said earlier on, educate people, educate. When you educate your staff, get them to go and educate their people. When we have opportunity, educate people from outside. I run a program now I call the Monitor Health. I just try to educate as many people as possible. Every week I make sure that at least 4,000 people is being educated through my platform. So it's the way we all need to find solution to this. Right, let's watch this thing because it tells us a lot about how we can play. Sometimes it doesn't play. Oh, this is nothing. So arrow. Hopefully I pray place. Okay, let's watch this together. So this is a nurse. He washed his hand. Could be a doctor. Alright. So is this okay? And he's going to see this patient. See what's wrong here? He hasn't used his mask, his gloves. So he's infected already with this patient. It could be corona. Say infected, but I know we will not say corona patient like this, but you don't know. So he's dumping in there, contaminated that came to see this patient. He didn't wash his hand. Came to see this patient, is infected this patient. You see how quickly this is going to spread in this hospital. No. It's trying to do this. You might just want to wash your hand. There's no water. Give me a bowl. No water. You contaminate the bowl. You walk away. And this guy is infected. Then the relative has come. They greeted him. And that one has not washed the hand. They go to the toilet now. That door is being infected already. See? So he's going to the toilet. This guy is just discharging it all over the place. So he just contaminated that place. You come for your break, or you come to it might be your office or whatever. Somebody's touched it, and you catch it. Then you are taking it to your family. Use computer system. I don't know how much. So this might be your laptop. It might be, your desk. Even your desk where you're talking to them. Just infect everybody. So this one is coming. Take it as well. There you go. That lady has been to the toilet. Has contaminated the toilet. Somebody else has been there. And then she's got it as well. Very quickly. And for each person, as we get it, you're giving to more people. Who washes their hand, now she's come to see the patient. To do things together, we need to find a way of breaking. If you wash your hands, you break that infection. Because he hasn't washed his hand, he's getting in here. Pull the cotton, contaminated the cotton. Somebody else will come and pull that cotton, get infected. And it's again giving it to this gentleman. During the process of us examining our patients, no matter how in a hurry we are, we need to learn to know that the purpose for us is to prevent infection and treat infection. You understand? So we need to put that at the back of our mind. With the community nurse, examine this guy, trying to get him to go home. So we're going to give everybody in the community. This guy, there's a visitor coming from the community, so it will be something that they're bringing from the community. If you don't put policy in place for them to wash their hands, get themselves organized before they come in, they give it to the patient, then the patient will come and give it to you. So we need to put policy in place, both angles. We need to think outside the box, whatever we're doing around, whatever we're practicing. Okay, so it then becomes an hospital infection. The community infection now is spread to the hospital. The COVID patient that comes in, you're seeing one person, you're going to another person, you're giving them, it could be any infection. You just tag the name infection. And there's the guy, he's taking it to the community now. See, it's very, very easy. So easy for us to actually spread infection from the hospital to anywhere. So just mere cleaning our hands, that's what that demonstrates. You can break the chain of infection, but if we do not do that, then it becomes, sorry, let's see where we are. We need to go further. Right, so to break the infection, we cannot, unfortunately, there's no how we would discharge our duties without being exposed to all this pathogen. COVID-19 has come to stay. We're going to live with this COVID-19, and we need to learn the processes by which we'll be using to deal with it, to protect our family, to protect ourselves. You understand? And the only way is every time break the infection. You just have to. There's no way around it. It's as hard as it sounds simple. It's so hard. You must just know that we need to break infection. You can't move close to me. Even if you are my Oga Kwata Kwata, if you move close to me, I will tell you just back off. As it stands now, because I need to protect myself. I went to see the commissioner. If he comes close to me, I'll just please back off. That's what I'm going to say. Or I'll pull myself back, because it's not about the position now. It's about our life. It's like you want to breathe. It's as important as that for us to break infection every time. You can't even overdo it at all. Okay, so and these are some of the ways by which we need to, to try and break it. So accurate identification of the organism. So if you think that infectious disease, we know now that we have the telltale signs. Patient coming, they said they have fever, they have sore throat, they're coughing, they have a nose smear, as long as they're presenting with things, or everybody generally unwell, that this person, let them go and take a swab. Let them go and take nasopharyngeal swab. You can't risk it. If you think they are suspects, you must deal with that fact that they're suspect and treat them as being a suspect for them to have have tests. It's not like we should not be treating our patient, because I realize that what's now going on in Nigeria now is a lot of patients are not being treated, especially the chronic disease patients. They're suffering. They're not having the treatment. More people will die from that angle if we do not look into that. That's where you need to sit down as a team. In Kwara, what do we do? I know that our group that is in charge of COVID, they're doing well, but at the same time, it's not only they will bring the centrally required policy, but at the local place that you practice, you need to also sit down and look at what are the local guidelines, what are the local policies you want to put in place. It's part of our role and job as a doctor. You get the right team, work with them, get those things based on your own hospital. You understand? And that's where your audit comes in. It's from when you have your own locally agreeable, or agreed on a policy. This policy, you need to check whether it's actually making a difference. That's where audit comes into play. These are the things we expected. You have to look at, are we actually doing what we said we want to do? So this is the guideline we put together. Wash your hand all the time. How many of us are washing our hand? What percentage of people do you want to have wash their hand? If you say 100% of us must wash our hand, that's a guideline. All of us must wash our hand every day or in between patients. You need to go and audit that and check. Get somebody to stand in when people are not aware, to count how many people are doing this thing. That's a simple audit. You could have done that and then say, oh, it's only 10% of us are doing it. Then you come and inform everybody. And say, okay, we did an audit. Even though we said that everybody should be washing their hands, don't mention name, don't point accusing finger. It's not necessary. That's the thing that just get me worried. When I tell her I've done something in this place, I've been in Nigeria and I've done a few audits, and I said I do audit. Who was it that did it? What's your business with who did it? Who did not do it? That's not what I want. The point is, are we achieving what we said we want to achieve? If we're achieving it, kudos. If we do not achieve it, there's no fight. Let's sit down and educate everybody, not even the people that are doing it, fine, let them be doing it. But attitude to learn, again, is very important, because a lot of people do not have the right attitude to learning here. Attitude to sit down, submit yourself, learn, no matter what position you are holding. It doesn't matter. We all have to learn. You understand? So come together. How many of these people have done it? Only 20%, but our target is 80%. What do we need to put in place? Bring everybody together without pointing any accusing finger. Whoever is doing it, kudos. If you are not doing it, all of us will come together. And I don't want to know in the meeting whether you're doing it or you're not doing it. The bottom line is we need to find out why people who are not doing it are not doing it. I don't care who is the person doing or who is not doing it, but from the results, how do we improve the number? That is where audit becomes important. You understand? So when you put these guidelines together, you must sit down together as a team to make it work. And it's not just one person's job, it's everybody's job. And we all need to get that mentality, you know? So you look at the environment, look at, you know, how do you get the reservoir? If it's, I talked earlier on about us getting vaccination. It's very important. You know, sometimes you might have to disinfect a place. You might have to decontaminate a place. If you have an isolation room or you have your side wall that you use for isolation, when a patient leaves the place, how do you deal with it? Are you only just going to disinfect the place, or you disinfect and decontaminate the place? What are the process? If that's the procedure, the policy you put in place, every time it must be the standard. It's not like this person come today, we're not doing it. Tomorrow we do this one. You're not achieving anything that way. A standard is a standard, and that's what you want to achieve in your organization, you know. And then educating people, educating your cleaners especially, they're very important here. Your nurses, they're really important here. You need to get them to have the same mindset as you are, not by fighting. Just like people need to understand. I don't understand why doctors will fight the pharmacists and nurses. It just changes. It's not in line with what we want to achieve. Our patients is our goal to take care of. And if we can educate them one way or the other, hopefully we have a spark of light. And then portal of entry, hand wash, you know, pest control and the like. Then when we talk about, you know, means of transmission, in order to reduce transmission, we look at lockdown, which we've done here. We do like isolation. You know, I talk about food hygiene because this is just general. Then airflow sanitation, hand wash, all these things are very important. And we look at the portal of exit again. You look at, you know, the procedures they're using, depending, I mean, how you carrying out your procedures in the hospital. And then if you have suspected cases, you need to have guidelines on how you want to deal with your suspected cases. You understand? Whether you're going to say, okay, suspected cases, lockdown, you must have your first day or whatever swab, and then you want to reswab them in 10 days or whatever. All those things you need to have a clear guideline on what you're doing. And everybody needs to understand it. Is spinning my video. Okay, that's fine. Sorry. So we carry on. So I've explained all these things. It's just that I've just separated them one after the other so that we can see what we're doing there. So let me just move forward there. Okay, sorry. We're already 1 hour into it, so I'm going to. Okay, so we need to start getting ahead with this thing. Then we need to know how we want to do it. You know, it's important because this thing, like I said, is come to hit us. It's here. You can't run. It's just here. Unfortunately, there's nothing anybody can do. You know, you can only try to protect yourself. But don't be selfish to protecting yourself alone. Protect yourself, protect your colleague, protect the public. So it's a responsibility. When we took that oath, if you remember, it's not about you're going to protect yourself again. On your patients, your colleagues, you have to protect them as well in everything you are doing. Patient safety at the center of it all. You know, protect them, use the right equipment. If you need to use the helmet, you use. If you need to use your full kit, you use. You know, it's very, very important for us to do this. It's all about continuous improvement. That is where audit becomes very important. You can't say that we've done it like this 20 years ago. I came to some of the hospitals in Kwara State. I just remember when I was a kid. Jesus, how can I be remembering things that moved? You go to the hospital. I mean, I wasn't in the renovation. MOP took me to the hospital. I told him, this is not an hospital, really. The place was smelling, stinking, terrible. And he told me, Femi, please, can we make this hospital to die your hospital in the UK? I said it's doable as long as the lead, the head is ready. As long as he's ready to work with me, he was happy. And I said, okay, we sat down, we started mapping things up. If you go to Federal Medical Center, Butimeta, now, you'll be shocked because that place is completely different. I could almost say that some centers you go to in there, you just think you're in the UK. You understand? He was ready. He was really ready, and he was ready to put things in place. If I say this, he will want to work with it. We'll say this, we'll work with it. He just made life easy. And then he brought the right team together. He brought the right people. We do training. He gave us training contract after we did the first phase. And then we still train as we speak. He doesn't, I mean, he invests on training. We train and train and train, because that's the thing I realized with Nigerian hospital is there's a culture that is disheartening. There's a terrible culture in our hospitals. As much as we have such terrible culture, even in high places in Nigeria, we have such culture in a culture of the fact that people don't want to change. It's terrible. Change is a constant thing. For us to have a constant improvement, continuous improvement, we must be very amenable to change. We must see change as our friend. It's a constant thing that has to happen. And then we shouldn't be afraid of it. You might change and break it. You'll fix it again. That's the truth. And that's the only way you can jump from hoop to hoop. When you stay in a place, you can't ever move. You cannot improve. You will come back 100 years. It will still be smelling the same Isaiah that I was smelling when I was a kid. You understand? So, and then it's not about there's no money. I understand there's no money. But the money that you have, what do you do with it? If you decide, okay, we're trying to, do you even think that these bugs are not resistant to some of these things? If you slap me, the first time you slap me, I might be very angry and painful, maybe cry. You understand? If you slap me again, what's wrong with you? What I do? It gets the time you're just okay, go back, go and slap it. So if you're using the same thing, you're slapping these bugs. You understand? They will look at you the first time you hit them, you kill them. But when you come the other time, they shake body now, and they start shaking body, and then you realize that you can't even move anything again. The only thing you will achieve is the smell of Isaiah all the time. The other things are happening. People are changing. They're looking at, okay, Isaiah doesn't fit, it doesn't kill again, Bagon doesn't kill again, let's look at something else. So things are dynamic, and then it has to be a continuous process within our health sector as well. But that's not the case as it stands now. But you are the people to make it happen. You can't do it alone. We all have to do it with others. So that's why this teamwork, NMA, thank you so much. I know that, of course, people everywhere there's bureaucracy. There's bureaucracy in NMA as well. But you guys are the aim of affair. Don't be selfish. Don't look at about your career alone. Look about what is the purpose, what's the core of NMA? Why are we existing as an association? What can we do? How can we impact the system, the life of our people? I see a country in Nigeria where people are dying and people cannot even, we don't even care about human life in this country. If we do, there's no reason why somebody will go and carry $7.5 billion and keep it in his backyard and say that his friend gave him as a gift. How mad is that? It's absolutely crazy. If he's eating the money or whatever he wants to do for his generation to come, he can't finish it. But that money is the money that we're supposed to use to improve our hospitals. And that's why we have to work together. We need to align somehow, somewhere. Right. And to do that, we don't need to make our face like this, to be honest. We don't need to. Because if we work together, then we can make our face like this. So WHO has places, they have things that they've, suggested that we'll be doing. We know that COVID-19 is a global problem. It's causing harm to patients, affect patient safety. 1 in 10 patients get infected while receiving care. This is generally for, hospital infection here. And 2/3 of deaths among the hospital are, in neonates. I remember I used this for something like that. But all these things, no matter what it is, you can actually avoid them. And to avoid them is going to be us putting things in place. This is what WHO has advised us. Have an IPC program in your hospital, infection prevention and control plan process. It might look like a pain for the first maybe 1 month that you're going to use to put this in place. This is where people get it wrong. You don't want to put that initial effort to make it happen. It could be NMA that wants to put an IPC procedure together for NMA Kwara. You understand? If you want me to be part of this, you want me to support, I'll be happy. It to be, don't even pay me anything. I'll be glad to come and join. It's my state. My father died there because these things were not in place. My father died in a lorry, untimely death. You understand? But it doesn't matter. I still have my mom there. I have my family there. There's no other place I want to go. So if Kwara can improve, I will be so happy. I'm here in Lagos because there's nothing for me in Kwara. You understand? If there's something for me to do in Kwara, I'll be in Kwara when I come home. But I have bills to pay as well. So I'm here and I'm doing a lot of these things. And if you want me to do, people pay for it here, but I don't mind to come and do for free in Kwara. Kwara is my home. Okay? So we need to educate and train best practices. We need to do, surveillances, and then, timely feedback. It's important for us to do our feedback right. When we do our audits, whatever information we get, disseminate it to everybody. There's no, all these are the things I'm saying. Little things, we say, oh, we can't disseminate information, but people they can call you, they can phone you if it's needed. What information are you disseminating on WhatsApp? You understand? What information are you disseminating on your social media? You can't see my social media, start gossiping or whatever. You see me talk about what I believe in. That's what I will talk about. If I get into a group, they start gossiping, I exit straight away. Don't even hurt me because I'm not interested. You understand? So you need to learn monitoring, audit, feedback, and we can get into details of this if it's needed for us to. There are details that WHO had put together for each of these topics, and we can talk about it. We can put in place if it's necessary, and NMA Kwara should be leading this, to be honest. So we need to build an environment that will be safe. We need to use the materials in the hospital, patient care activities. There are things that we just can put together that will make things better in our practice. And we know that wherever we are now, we should be developing. That's why this training, I really appreciate it. I'm supposed to be somewhere today, to be honest. I'm supposed to be seeing Dr. Jide Idris. I just had to just say, okay, look, Oga, I have something very much important for me to do this morning. And that's why I'm staying here. That one is business. This one is actually my life. You understand? So it could be poor. We can say that as we are now, maybe the situation is poor, but we're developing. Let's still see us developing. Let's put things in place to see that we're developing. We're growing. We're moving until we aim for this outstanding position. It's doable as long as we put our mind into it. When I went to Ebute Meta, that's about 3 years ago, I think it was like this. We started pushing, developing. I can say comfortably, Ebute Meta is here. But that's what we're aiming for, and it's going to happen. Okay, so what's next? Where are we going next? That answer is now for you to answer what you want to do as to where we're going next. Thank you so much. I'm going to just put it okay. Any question for me?
Okay, please let's appreciate Dr. Ogunremi. It has been a very stimulating lecture. It's not just one to teach us how do infection prevention and control, but it's one that has stimulated me to do well in my center, and I feel that everybody should also be stimulated to do well also in their own areas. So please, I would like us to send in thumbs up to appreciate Dr. Ogunremi for this time. Please let's all send in like a thumbs up for you. Thank you very much for your message. Please let's send in thumbs up. Let's send in a message to appreciate our speaker. Like I said earlier, it was just yesterday, day before yesterday, that I contacted him and that I coerced him to be here with us, and he agreed. He said Kwara is home and that he has to be here with us. So let's, if there's any question, And also, I would like to add that he's not supposed to be here with us today. He actually lost a mentor yesterday, somebody very dear to him, but still took the pain to be here. We pray that his soul will rest in peace, and God will give him the fortitude to bear the loss.
Thank you.
Are there questions? Yes, Dr. Olawipo has a question.
Okay.
Our immediate past chairman. Okay, I'm coming. Just a second, sir. Okay, you can unmute, sir.
Oh, mute. What's your job? Use the off.
Prof, I can't hear you.
Hear me now?
Okay, a bit better.
Not in the comment. Can you hear me?
Prof, you're breaking. I think your network is quite bad. If you can hear me, please. Maybe you should just type your question because I can't make a head of what you're saying.
Can you hear me?
Oh yeah, it's better now.
Okay, maybe it's the network.
Oh yeah, it's better now.
Better now. Okay, I think it's just the network. So I said it's not a question, just to thank you for stimulating lecture.
Okay.
Thank you for the stimulating the notice. And again, on behalf of NMA Kwara, I appreciate you. I remember some time ago when you did a workshop with us, like 3 years ago. That was very close to losing your dad. You still did the work. Again, now, and you still decide to raise the vote and then ahead. I want to thank you. Again, as Vice President, I congratulate you as the President. That you are keeping you are flying our flag. We are very proud of you. Thank you.
Thank you so much.
All right, thank you, our immediate past chairman, Dr. Olawipo. Is there any other question from any other person? Okay. Ademola Christie, please, you can ask your question. You can unmute and ask your question. Okay. I think this is Professor Olukoba, sir.
Oh.
Good afternoon, everyone.
The network is so
This
bad.
is I want to congratulate the presenter. Hello.
Yeah, we can
Hello,
hear you.
I can't
hear you.
I can't hear. It's breaking though.
Okay, if your network is not strong enough, please you can type.
Yeah, please type your question if there's any question there.
Okay, Dr. Abdul Ghani Oloko.
Yo, thank you.
Oh, wow. How are you? Wow.
I am fine. Well done. We appreciate for the beautiful lecture.
Thank you.
In fact, it has been of benefit. I want you to enlighten us presently the WHO. So now they said healthy carrier cannot transmit the disease. Secondly, they initially said the virus was airborne. They now come up to again to say it is a droplet that they almost wanted to condemn the use of face mask. That most important is the physical distancing. So and then even all our initial preaching and approach that we should try to avoid crowds and the number of people that are in a gathering. So I want you to enlighten us, please, about those that the healthy carrier cannot transmit the disease.
Yeah.
That
okay.
The disease is not airborne but a droplet. I want you to, because it's like it is confusing. You have spent to some people on some, and then the following day, you said like who is confusing us? Is it with doctors or the WHO?
Okay.
Thank you, please.
Thank you so much, Dr. Loko. All right, so that's a very, very interesting question, and I think a very, very important question as well. So, from the point of the fact that the virus does not, a healthy carrier might not, well, it categorically says cannot based on research. Now, what I would say is this: this virus, novel virus, it's a virus that today will say this, tomorrow will say this. Purely because, please, can we? So because when we look at the virus that is a novel means that we're still interacting, we're learning, we just keep going. So we're not sure. A lot of the times things happen, we're not sure. So the mindset today that a healthy carrier, based on the research we have, that the healthy carrier cannot transmit it. The thing is, Ademola Christian. Can you mute this lady? Okay. Okay, so as I was saying, the virus is a novel virus, which means that we're still learning. We can say things today doesn't mean that it's going to be the same thing next month because we're learning. That's why it's a novel virus. But where they stand now, that's what the research shows. That's why they advise. When you say that you want to be, you want evidence-based, WHO wants evidence-based. So it's every practice should be evidence-based practice. But as a clinician, you have to then put your hat on as a clinician. If you say it's evidence-based result we're having, on that basis we're advising you. Remember that this is a virus. Things are changing as we're going. So they might say today, by talking, you can transmit the disease. And maybe I should share. I have a video I can share if time permits, and you want me to. I will share it on my phone. I'll just connect my phone to this. You see how a kind of research that was done, whereby people try to see, if I'm talking, can I actually transmit this infection? Or if I cough, how far can I transmit it? You understand? So a healthy person who is already a reservoir is carrying this virus. You understand? We initially said the virus was airborne. Later we said, no, it's not airborne, it's a droplet. But we say it's a droplet, but you can transmit it by talking if you are infected. And then we now say, okay, but if you are infected and you are healthy, you cannot transmit it. Between 1 day and 2 days, you can be a carrier that is not, particularly unwell. The next day you can be carrier that is unwell. So within a flash of a day, we're saying there's a difference. As a clinician, you have to think about that and process it. And on the basis of that, I personally will take a decision. What I'm going to do. Whatever people tell you is a guideline. What you do is what you do what you find based on the information. So it's not an informed decision that you have to make now. But left to me, I think because it's a novel virus, I'm not going to say that somebody who is healthy cannot transmit it. You understand? Because if you say that somebody has other infection and they're healthy, can they not transmit it? If they're a reservoir of infection, chances are they might be. Then the research has shown us that, yes, we have to guide ourselves with that research. But I agree with you, Dr. Oloko. There's a lot of talk around that, to be honest. People are still discussing it. But where I stand, based on information I have, is I would suggest look at it closely. If you're healthy and you're carrying a virus that we're not sure of, we do not know very well, things will change tomorrow. So they might then come back again tomorrow and say, oh, based on the research we have now, this is what we're seeing. And it's possible, it's very, very likely that will come up very, very soon, because a lot of people will be doing this research and then we can see. But to me, I think healthy or not healthy, I said it when I started that presentation, any patient that walks to you is a potential carrier. Take it that way. Protect yourself. Be on the guard all the time. Regardless of whether they look healthy or not. That's what I'm going to say. Use your PPI. If later, then you then say, okay, this person doesn't have it does not transmit it, fine, you're still okay. All of us have to protect ourselves. It's the people that will be alive in 2 years' time or 1 year time when we have the vaccination that can then see whatever is going on. Because if you contract if somebody gets infection and then unfortunately, people will die. About 5% of people are dying from this infection. You understand? So, and we pray we're not going to be one of those percentages. But at the same time, the answer to it is be on the guard. WHO guideline or whatever doesn't matter to me, because when we started, we said it was airborne. Later, we said it was droplet of infection. You're right. And then now we're saying that even by mere talking, you can actually disseminate it. So it means that we're not sure, and that's what the novel virus is all about. You're not sure. That's why it's a novel. So that's the answer I can give you. I hope I answer your question.
Thank you very much, Dr. Ogunremi. We have one of our fathers in the house, Professor Mokolu, and his hands are raised. So please, sir, kindly unmute your mic and ask your question, sir.
Thank you very much. And thanks to Dr. Ogunremi. Always a pleasure hearing you on many of these issues. I just wanted to buttress what you have said, actually, that the methods of transmission are not limited either to just talking, and we have other methods of transmission. So the debate about healthy carriers also transmitting or not, I even think it is generally superfluous, since we have established that anybody can transmit this through a physical, serving as a physical vehicle of transfer. from one surface to the other, which is why we wash our hands and do the sanitizing. I guess it becomes immaterial, therefore, what your current health status is, other than have attitude of eternal vigilance and knowing that anybody can be a medium. So we don't take anything for granted. As it's been reported, some of the most susceptible people, I mean, people who have acquired, a number of them have been from friends. Okay, we all of us may put on masks and things like that when we are going to church, when we are going out. But then, when a family member comes to visit, we drop our guards. When a friend comes to visit, we drop our guards. So all of these people that we have somehow psychologically excluded as if they don't constitute a risk, those are actually the ones that then ends up constituting a risk. So let the science continue. Let them continue to find out what they are finding out. But also, it's important that as we are on ground, we should continue to process information. I work closely with WHO, and I know how they try to navigate and strike a balance in many of their statements. And so it might take us a little while and a concrete set of evidence before even what WHO says is going to be a total gospel truth. So I think for now, as you have pointed out, we don't know. So just be on the guard. Don't drop your guard. Anybody can be a source, and then we can be infected. And then those who are talking about it being airborne, they have been speaking in the context of closed environments largely. Okay, so, and the fact that you have limited circulation of air, you have people there in such concentrated places, I think it just makes logical sense that whatever it is can still hang around for a while, and therefore that's a special risk. I don't think they are saying it in the context of you just walking along the street and then you just blow one air inside you and then you are contacted coronavirus. So I think I just wanted to add those contributions. Thank you very much, Dr. Graham.
Thank you very much, Prof.
Yeah, I think from what Prof has just said, yeah, again, like with the airborne, theory, obviously, if in an enclosed environment, it's being stated that if you blow air, if you carry the virus can actually circulate in the air for about 4 hours. You understand? So that's why it's very important to encourage people to wear face masks when they're coming to you. Because again, we're not sure. And then we can't drop our guard, just like the Professor said.
Okay. Thank you.
All right. Thank you very much, Dr. Ogunremi. Thank you very much, everybody, for coming on board. One thing I would like us all to take away from what Dr. Ogunremi has said is us taking responsibility for our nurses, taking responsibility for our cleaners, taking responsibility for people around us. I personally trained all the nurses, trained all the cleaners in my hospital on infection prevention and control. I think that is one challenge that we should take. What can I do to better my environment? What can we do as NMA Kwara to better the lots of doctors? And as we've heard from Dr. Ogunremi, he's ready to come to help us for free if we need his services. So we really appreciate you, Dr. Ogunremi. We thank you so much for putting aside so many of the things that you have to do to be with us. And I'll say again, thank you for honoring us on such a short notice. We want to appreciate our fathers, Professor Okeshino and Professor Mokolu, for joining us. I want to appreciate my senior colleagues. I want to appreciate Dr. Fakmonle. I can see you all the way from Abuja for joining us also. A lot of people that I cannot mention. We have lots of people that joined and also have left. my senior colleagues, my colleagues, our friends, and our senior colleagues, and my fathers and my teachers rather that have joined us. Dr. MSK Sholagberu is also with us, the NMA Kwara chairman. We also have Dr. Professor Issa Baba joining us, the immediate past president of ARDUITH, and we really appreciate everybody who is joining. We also want to appreciate those who are joining us from the big screen in the secretariat here. We have a big screen out there, and we have a couple of people who are watching from the big screen in the secretariat. We really want to appreciate everybody for coming, and we hope that this stimulating lecture would stimulate us to continue to do the right things at the right time. And we pray that God will bless us. AGM continues on Saturday with our AGM and elections. So please, let's try to come. We are going to maintain social distancing. The plan is that we have 5 big screens in the secretariat, and we are going to do a Zoom meeting, but for voting purposes and constitutional purposes that have not allowed for virtual meetings, we want everybody to also be here. So we also want to appreciate Professor Wahab and Professor Ajiboye rather, for also being with us. We really appreciate you all. So we've come to the end of today's Zoom meeting, and we want to say thank you for coming. Okay,
Thank you so
before we go, also Professor Alabi was also with us. Thank you very much, everybody. Thank you very much, Dr. Ogunremi. Thank you, sir.
Dr.